Tanisha, Julia and I are here to talk about how to care for a patient presenting with a diagnosis of psychosis whilst implementing clinical reasoning. We'll be talking more about clinical reasoning later in the presentation. Psychosis is multi-layered and can be defined as a common and functional disruptive symptoms, many psychiatric, neurologic and medical conditions, and an important target of evaluation in psychiatric practice. The definitions of psychosis used in the DSM-5 and the International Classification of Diseases are presented, and hallucinations, delusions and delusional misidentification syndromes are defined and tabulated. During this presentation, we'll be looking at the etiology, epidemiology, assessments, treatments and nursing interventions. And we're looking at how to support the patient, the family, and how it affects the patient, family and the community. Epidemiology of psychosis. According to a survey conducted in 2010, it was estimated treated prevalence of psychotic disorders in a 1-month period for people aged 18 to 64 was 3.5% per 1,000 population, and that the most common disorder was schizophrenia. The onset of illness was under 25 years for 64.8% of people surveyed, and for the most, the onset was insidious. The etiology of psychosis. The psychotic episodes in some people can be caused by genetic predisposition, mental health disorders. A few examples can be schizophrenia, bipolar disorder, severe stress or anxiety, severe depression, including postnatal. Some example of medical conditions that can cause psychosis is HIV, AIDS, malaria, Alzheimer's. Substance abuse, such as alcohol and drugs, can also cause psychosis, and in rare cases it can be a side effect from prescribed medication. Research has shown that the psychological pathways can include trauma and adversity. Clinical reasons relevant when providing healthcare in relation to psychosis can assist with developing patient-centered care. To assist with that, we can use a clinical reasoning cycle. There are 8 steps. Step 1 is to consider the patient's situation. Step 2 is to collect cues. Step 3 is to process information. Step 4 is to identify problems or any issues. Step 5 is to establish goals. Step 6 is to take action. Step 7 is to evaluate outcomes. Step 8 is to reflect on the process. Nurses need to develop their critical thinking and clinical reason skill. The attributes needed are a holistic approach, creativity, inquisitiveness, perseverance, intuition, flexibility, academic integrity, reflexivity, confidence, and open-mindedness. By developing these skills, it allows the practitioner to practice effective patient-centered care.
The Early Psychosis Guidelines Writing Group recommendations can be separated into 3 areas of assessment, including biopsychosocial assessment, physical assessment, and risk assessment. There are also additional assessments that can be made if there is a potential for alternate causes of psychosis. For the biopsychosocial assessment, the Early Psychosis Guidelines Writing Group recommends that this is to be conducted by the acute treating team. This assessment can consist of mental state examinations, physical examinations, cognitive assessments, comorbidity assessments, and risk assessments. It is also recommended that this is aided by an additional antipsychotic-free period of assessment. Furthermore, it is also recommended that this is to be conducted within the first 48 hours of the suspected first episode of psychosis. For physical assessments, Byrne recommends that baseline assessments, cardiovascular assessments, and metabolic assessments are to be conducted and repeated 3 months post-commencement of antipsychotics, then annually thereafter. In addition to these assessments, it is also recommended that regular substance use and other psychiatric disorders are to be noted and assessed each physical assessment. The Early Psychosis Guidelines Writing Group recommends that risk assessments must be conducted at each visit. This must include assessments of risk to others and non-adherence to treatment. Should the biophysiological assessment indicate a potential for an alternate cause, such as organic causes or comorbidities, This should be investigated accordingly. These assessments can include LFTs, known as liver function tests, ECGs, which is an electrocardiogram, EEG, which is known as an electroencephalogram, CT, which is computed tomography, or an MRI, which is magnetic resonance imaging. The treatment of psychosis can be accomplished through the following recommendations. The National Youth Mental Health Foundation states that the continuity of care throughout a patient's treatment of psychosis is paramount in achieving a successful outcome. This can be achieved through implementing a caseworker. Bird et al. Recommends intervention and therapy, including early intervention services, family intervention services, and cognitive behavioural therapy. Byrne recommends pharmacotherapy, including the use of benzodiazepines for sedation and typical and atypical antipsychotics.
As we move through this PowerPoint, we come to the effects of psychosis and how psychosis affects daily life. First, we look at how psychosis affects an individual within their daily life. So, psychosis affects the ability to maintain fulfilling friendships as they struggle with showing their emotions correctly. Now, this can lead to sudden and abrupt mood changes, which can ultimately affect friendships due to the uncertainty of their emotions and also how they perceive reality. Psychosis can also affect the individual mentally within their daily life, as psychotic people have a harder time learning new information and also remembering dates and times, which can make it harder for them to then communicate with different people and also puts added strain on themselves as they struggle trying to remember dates, times, people's names, places, or any kind of information that they're willing to share with others just to create a conversation. Now, they also tend to generate false beliefs, and this can also increase their paranoia and lack of trust around others as they think that everyone's out to get them and they feel in somewhat way threatened by this. Now, they also feel a lack of self-worth and happiness due to them forgetting information and creating these false beliefs, which creates the paranoia from a daily basis. And this then ultimately results in them feeling unhappy within themselves. Family members may feel overwhelmed with juggling the emotions of their loved one being diagnosed with psychosis, and also this puts them at the different grief stages throughout the diagnosis, meaning that they aren't always on the same page with everything, which can then cause conflict between family members. Financial strain is also increased if a family member is moved to a mental health facility, and also trying to factor in distance for the right mental health program to look after the loved one can also be a challenge that family members must face. Now, let's talk about community. So first off, psychosis patients can have some difficulty finding safe housing for them to live. Now, this might be a mental facility or a secure house program that specifically targets mental illness patients, or depending on the severity of the individual themselves. However, with this, there is always negative stigmas and stereotypes surrounding mental illness, such as that they might be aggressive, violent, mentally disturbed, or weak-minded, ultimately which leaves the individual feeling rejected or discriminated against, which can lead to bullying amongst the workplace or school or any type of community environment. So, to prevent this, providing appropriate education resources are useful in reducing the negative connotations that are associated with mental illness, which can ultimately improve the individual who does have a mental illness.